So welcome everybody to our latest online webinar in which we will discuss the findings from a new report launched today online titled Lives Saved, Tobacco Harm Reduction and Better Treatment Could Save Nearly 880,000 lives up to 2060 in Malaysia and Uzbekistan. This report is available on thr.net. We will post the link at the bottom of this video and on the thr.net website under resources. The outstanding group of authors of this report, who I will introduce shortly, recognise that the burden of smoking and its related diseases in these countries is significant, and that the global progress to reduce smoking rates has stalled and more needs to be done by the WHO and governments to reduce the death rate from smoking and toxic, unregulated oral tobacco products. This report focuses on Malaysia and Uzbekistan because both have equivalent populations, smoking prevalences, and in both countries, there's a threat of highly restrictive regulation and even bans on smoke-free tobacco harm reduction products. This would leave smokers who cannot or will not quit cigarettes with no other alternative to escape the proven dangers of cigarettes. The report highlights how the quality of evidence of the benefits of smoking cessation and tobacco harm reduction have been strengthened. Using simulation modelling techniques, the authors then calculated the potential lives that could be saved if the Malaysian and Uzbekistan governments were to embrace tobacco harm reduction, better cessation services, and improve lung cancer treatment in the two countries, in addition to tobacco control. The main goals of public health is to prevent disease and premature death, so this report is a timely reminder of alternative solutions to curb the tobacco epidemic beyond standard tobacco control. I will now present the agenda and the speakers. So today I've already briefly discussed why we are focused on Malaysia and Uzbekistan for the report. We then have a keynote speech by Dr. Derek Yach, who is the lead author, and he will provide a report overview, the study rationale and significance of the study, the methodology, the results and recommendations, and he'll also answer a question about COP11. We then have Professor Dr. Sharifa Ezat of Malaysia, who will discuss the importance of this study in Malaysia. And she'll also mention how the results should be used to implement policy change in Malaysia and how other countries can learn from this study. So just briefly, I'll walk you through the biographies of the authors. So we have Dr. Derek Yach, who is a former WHO and PepsiCo executive. He's a physician and holds a master's in public health from Johns Hopkins. He also played a key role in the WHO Framework Convention on Tobacco Control and led global health at Yale and the Rockefeller Foundation. Then we have Professor Dr. Sharifa Ezat of Malaysia, who is a medical doctor with a PhD in health economics, focusing on health policy, inequality and economics. And she is currently as a consultant, and she has advised Malaysian ministries on hospital efficiency, occupational diseases and autism prevalence among children. So we have our lead author from Uzbekistan, who's Dr. Darmin A. Azadov, who is head of the Public Health Department at Tashkent Institute since 2003, and he has 30 years of experience in healthcare reform in Uzbekistan and Africa. He specialises in pediatric and obstetric care, healthcare quality improvement and bioethics. He's worked with the WHO and UNICEF. We then have Dr. Alisher Sharipov, who is our second Uzbeki author, and he is professor and head of the Department of Emergency Pediatrics. He's a qualified physician and specialist pediatrician from Tashkent University, and he has been involved in several work groups with the government Ministry of Health, including South Korea. We then have Dr. Delon Human, who's also a key author of the report. He's a physician and he has extensive experience in global health strategy, harm reduction, and healthcare access. So just a quick overview in terms of the facts and figures for each of these countries in the report. So we have the population there of 34.2 million of Uzbekistan, the life expectancy for males and females, tobacco-related disease. So the 2 of the top 10 causes are linked to smoking. And then we have smoking prevalence rates for males and females. And then the conclusion in the report, which is represented here at the bottom, is if tobacco harm reduction, improved cessation, and lung cancer treatment were added to traditional tobacco control, then 464,000 lives could be saved by 2060. So that's one of the interesting findings. And we have the same here for Malaysia as well. Population of 31.8 million. So the life expectancy numbers there. And this concluded that there would be 416,000 lives that could be saved by 2060 if tobacco harm reduction, improved cessation, and lung cancer treatment were added to the traditional tobacco control policies. So now I will hand over to Dr. Derek Yach, who will provide his keynote speech.
It's a real pleasure to talk to you about the release of a very important new report that addresses smoking and how to prevent it and end the death it causes in Malaysia and in Uzbekistan. What makes these countries similar is that they have roughly the same populations, 30 million for Malaysia, about 33, 34 million for Uzbekistan. They both are Muslim countries with a long tradition of recognizing the importance of faith in driving policy. And when it comes to smoking, they have very similar rates of smoking in respect of women. So in both cases, less than 2% of women smoke, which is something I believe we need to strengthen as the social norm for the rest of the world. When it comes to smoking among men, adult men in Malaysia smoke at a rate of about 35 to 40%. And in Uzbekistan, about half of that, about 20%. But in Uzbekistan, there's a considerable use of very toxic smokeless tobacco products that people chew called Nazway. And they have been used for many, many decades and constitute a particular risk that is unseen outside most of the region, which includes not just Uzbekistan, but many of the other Central Asian republics. This report was really carried out because of the importance of the overall use of tobacco to death and disease. And to put it in perspective, about 27,000 people die annually because of tobacco in Malaysia, and about 32,000 die in Uzbekistan. And remember, these are going to be mainly men. They would be dying of traditional smoking-related conditions, particularly lung cancer, COPD, and ischemic heart disease. In Uzbekistan, the actual causes of death are much broader than in Malaysia, given that they have a lot of issues related to development as well. And of course, tobacco use ranks as one of the top 10 risks to health in both countries. Against that backdrop, we recognize that the use of tobacco harm reduction products, the full range of them, whether we're talking about snus and e-cigarettes, heated tobacco products, nicotine pouches, and even some of the new forms of hookah or shisha that remove charcoal and have more of an e-cigarette type approach, could have an enormous impact on death and disease in the two countries. Further, we know that lung cancer, being such an important cause of death, is undergoing a real revolution in terms of treatment and diagnostics. And if this was improved, we believe that there'll be also a gain to lives saved. And so we set out to try and calculate how many lives would be saved from now until 2060, beyond what we're expecting under the status quo of the WHO trends, which would include their major focus, which has been on regulations such as taxation, banning advertising, trying to promote cessation. On the last, I must add the point that smoking cessation in both countries has not really received much attention, substantially more in Malaysia than in Uzbekistan, but the infrastructure for supporting nicotine replacement therapy and reasonably effective forms of cessation is still pretty rudimentary. And that constitutes a real issue that we need to focus on and we put in the report. So in the report, We project it out over the next few years. And you might say, well, how do you do this? Well, we do it using many of the sophisticated modeling and epidemiological studies that are well described in the report and led by both private and public researchers around the world. And we then use a bunch of fairly conservative estimates on what will be the uptake of tobacco harm reduction, what will be the uptake of cessation. And in the case of better lung cancer management, we believe that in the case of Uzbekistan, the uptake will be substantially less than in Malaysia. Before giving you a sense of the results, I think it's important also to note a very significant difference between the two countries is that in Malaysia, there has been over the last decades a very strong focus on non-communicable disease prevention. They have very active nonprofits called Better Health that run and focus on all of the major risks, particularly diet, physical activity, obesity, and mental health, which Uzbekistan still trails far behind on. I know that because I've had an opportunity when I worked for Vitality and their largest insurer in Malaysia, AIA, to take part in a number of major national meetings in Malaysia, where you got a sense of a country really on the move and a country really focused on trying to improve the health of the population. Missing, though, was a focus on ending smoking, as very much missing was a strong enough focus on harm reduction. In both countries, many of the harm reduction products, particularly nicotine pouches, heated tobacco products, and vapes, are readily available. Their regulatory status is a little bit uncertain, but that doesn't stop the market and the consumers demanding, using them very extensively. But they don't come with a full endorsement yet of government or the physicians. So when we project out over the next few years, we estimate in the case of Malaysia, the 27,000 deaths a year currently from tobacco be cut to 7.6 thousand over the next few decades through improving access to tobacco harm reduction, cessation, and better treatment. In the case of Uzbekistan, the 30,000 deaths a year be cut to about 8,500, a huge reduction. If you then multiply that over the next few decades, we're talking about 416,000 lives to be saved in Malaysia and 465,000 to be saved in Uzbekistan. So between them, just short of 500,000 lives could be saved by putting in place what we currently have as available as tobacco harm reduction products and what we currently have on the shelf in terms of better cessation. One needs to ask the question, well, if that seems so self-evidently beneficial, why is it not happening? And there are a range of reasons. There remain a number of international obstacles and people pushing against the value of tobacco harm reduction. There's a lot of misperceptions about the fact that tobacco harm reduction may be as risky or riskier than cigarettes, which they profoundly are not. There are a lot of concerns about the hazards of nicotine, that it may cause cancer, which it does not. And the enormous pressures coming from organizations which these two countries look to for advice, be it the World Health Organization or a range of nonprofits around the world. So what do we believe needs to happen? A couple of very specific things. First, we believe that the role of physicians is always decisive in these matters. What physicians do, what they tell their patients, they tell their governments, has an enormous effect on all aspects of public health policy. And we believe there's an opportunity in both countries for them to learn from what the British Royal College of Physicians have done, put out regular reports debunking the myths and urging physicians to use tobacco harm reduction as probably the most effective means of assuring cessation. Secondly, we believe that governments need to relook the way they address tobacco control and recognize that for products like cigarettes and for some of the products like Nasway, in the case of Uzbekistan, we need tough tax policies, we need strong warnings, we need to do what we can to avoid use in public spaces. For many of the harm reduction products, we need a much lighter touch. We need to focus on the safety of these products. We need to make sure that these products don't get into the hands of young people and kids. We need to make sure that the smoker understands and has access to them as a better alternative to smoking, in accordance with the language of the Food and Drug Administration of the US, saying that these are appropriate for the protection of public health, particularly in the case of smokers. Secondly, we believe there's a need. Thirdly, there's a belief to strengthen the research capacity of countries, having local researchers who can put their own data out on the benefits and risks, who can show what's truly working in their own country and carry out surveillance on progress, drives national policy, drives national attention, and drives physician interest. The good news is that Malaysia has actually got an extensive health research history and program. And in fact, in the last couple of years, has already put out priorities for tobacco harm reduction research that I think are worthwhile reading and looking at, since they really highlight exactly what needs to be done. Finally, and I think what makes the region unique or interesting compared to, say, Europe or the USA, is the important role of religion. Faith-based organizations have generally started to play a very important role in addressing many complex health problems, everything from HIV/AIDS to diabetes and obesity. And having the role of the organized faith leaders understand the value of harm reduction as a means of saving lives, we believe would be coherent with so many of the core values of the religion, and also be a way of reaching many thousands, if not millions, of people on a regular basis when they go to Friday prayers, for example. So finally, I feel fairly hopeful given the fact that consumer demand is extremely high for these products. Consumers know the value. The numbers of smokers demand that we take action. And in both cases, we're looking at countries seeking to increase their economic development and prosperity. Improving the health and quality of health and life of people is the best way forward. So let's put tobacco harm reduction right at the front of our policies to end smoking.
Thank you, Derek. I have one question for you regarding COP11, which is due to take place at the end of next year. What is your advice to member states regarding harm reduction, please?
Well, I think the first thing they need to do is to really study the evidence of what's happening in countries where harm reduction products are available on a large scale. And we've now got fantastic case studies. Let me give you a few. We know that the history of the last few decades of Sweden focusing on snus and nicotine pouches has actually translated into having among the lowest cancer rates and overall mortality across Europe. Very strong evidence. We know that in Japan, a different route was taken. Heated tobacco products across many brands are leading the way in displacing combustible cigarettes at a rate that we have not seen anywhere else in the world. Almost a 50% cut in adult male smoking rates due to the expansion of heated tobacco products. When it comes to vapes and e-cigarettes, we see great examples from the UK, from New Zealand, from the US, of how these products are also displacing combustible cigarettes. And importantly, they're not leading to increases in cigarette use among kids. In fact, we now have about the lowest levels of smoking and vaping rates in American kids in the history of the records that we've been able to get going. All to say that all of these trends, plus examples in many other countries, suggest that they need to look at what the evidence really says and go to the Framework Convention text, which clearly includes harm reduction as a core component of tobacco control. And look at countries like the Czech Republic, where we understand that tobacco harm reduction is integrated as part of their national harm reduction strategy. That seems to be the way forward. The second thing I think they need to do is to recognize that coming out of COP10, there was a call to define priorities needed for tobacco harm reduction research. And we will shortly be able to share with countries well before COP11 ideas about how to think about that for your own country. Certainly our view that we need to have some global health research priorities, which have not yet been set by WHO. What are the things we need to know across all countries that will unblock the needed blockages to progress? But very importantly, that isn't good enough. We need to know what countries need to do within their own territory to actually drive progress. And those tend to be focused on improving high quality surveillance that's used on time, addressing the issue of physician misinformation on a regular, continuous basis, and looking at how to ensure that you're providing the educational support required to actually move the agenda ahead.
So that was Dr. Derek Yach of the US and South Africa. And now I'm going to hand over to Professor Sharifa Ezat of Malaysia, who will discuss the importance of the study for Malaysia.
A very good morning to everyone. I'm here to talk about smoking and the impact of LifeSafe, which is available in Malaysia. Smoking in many of the low middle income countries are a problem, as in Malaysia as well. Smoking is a huge problem in Malaysia, and we have a high number of people who are smokers. Back in the year 2019, from our National Health and Morbidity Surveys, it shows that almost 40% of our males aged 15 and above are smokers. And these are definitely less among the female, which is only at 1.2%. But the trend has changed. From our National Health Morbidity Surveys, quite recent in 2022, it shows that among the adolescent, 13 to 17 years old, it shows there's a change of trend where you can see that among the number of people using cigarettes has decreased to about 6.2%, while the number of people who are assessing, or the youth assessing e-cigarettes or vape, has increased about 14.9%. Now that shows a differentiation of how people perceive tobacco and combustion in the country. Why is this report important? This report, which is the LifeSafe report, shows the impact of tobacco harm reduction, but also better treatment, how they are able to save nearly 880,000 lives up to the year 2060 in two countries, which is Malaysia and also Uzbekistan. And it emphasized the need to calculate potential life of adult smokers that can be saved by improving tobacco control through, one, the WHO Empower strategy, but also, two, to complement it with new tobacco harm mitigation strategies. But we also need to, three, improve access to cancer, lung treatment, respiratory diseases, but also better screening. This is especially among tobacco users with little or no intention to quit, or have failed through the traditional NRT tobacco cessation programs that is already widely available in the country to our public but also private healthcare system. The current tobacco laws, which is already available in the country, needs to be refined on what are the vaping products that contain nicotine, and this is to be delineated by the strength that might be already dangerous to youngsters. This is to outlaw but also deter our minors from obtaining both combustion cigarettes and also nicotine. Enforcement control also has to work hand in hand with border control to reduce the increasing black market available. In many of our surveys that has been done in the country, the top reason that vape users are vaping is to switch to a so-called a lesser evil. Unfortunately, there's no quality checks or toxicology reports which are available in Malaysia yet for our products. However, bear in mind a too extreme prohibitionist approach will see an increasing trend of illegal markets. This will soar and many will provide unbridled access to youth smoking but vaping at the same time. Health professionals, which are the core of healthcare in the country, need to be able to be ready but also discuss on how to access clients who are avid smokers or poly users and advise on tobacco cessation program, provide motivations and support to continue persistent to quit smoking altogether, but also advise on what are the other methods available to quit smoking if the NRT treatment fails. From the report, it shows that a total of around 416,000 lives that could be saved in Malaysia alone if improved tobacco control, together with tobacco harm mitigation products, are made accessible to certain groups of population, if better cessation services were developed, and if early access to screening and treatment of respiratory diseases and lung cancer are introduced over the next 4 decades.
So Delon, did you want to say a few words about the importance of this study in Uzbekistan? And do you have any conclusions you would like to leave?
Thank you, Jess, and congratulations to the authors of this report for making an important contribution to the prevention and control of tobacco-related disease, disability and premature death, especially in Malaysia and Uzbekistan. Context is important in public health. none more so than what we all learned during the COVID-19 pandemic. And at the end of 2021, WHO published a report on lessons learned during the pandemic. And 3 of the recommendations apply almost completely to what's happening in tobacco control in Uzbekistan and Malaysia. Number 1, WHO called for improved governance at the highest political decision-making level with a whole of society, whole of government approach in addressing these emergencies. This is absolutely applicable to tobacco control in these 2 countries. Secondly, WHO calls for risk communication in a timely and transparent manner while eliminating and managing misinformation. You'll remember that during the pandemic, there was also huge debate about the use of vaccines, but ultimately the vaccines were used as a harm reduction tool to help prevent serious disease and death, premature death because of the virus. Again, this is absolutely applicable to tobacco control in these countries. And thirdly, they called for increased research and development in addressing these public health emergencies. That's exactly what this report has set out to achieve by using simulation modeling to better understand how many lives can be saved if governments and WHO were willing to embrace tobacco harm reduction methods, science, and products, so that those smokers who cannot or will not quit smoking were given regulated access to these smoke-free products as a way of escaping tobacco-related disease and disability, and in this case, premature death. Uzbekistan is a country which is particularly important to understand what role tobacco harm reduction can play. So at the moment, 47% of all lung cancers in Uzbekistan are caused by cigarette smoking. The number 1 cause of death in Uzbekistan is ischemic heart disease. Again, cigarette smoking is the most important risk factor. Now, despite this, WHO predicts that by 2060, there will still be 20,000 lives lost because of tobacco if nothing else changes and if the status quo were to be maintained. In this report, the authors call for an embracing of tobacco harm reduction products, early diagnosis of lung cancer, and improved smoking cessation, and then calculates how many lives could be saved if these measures were implemented in addition to standard tobacco control. In the case of Uzbekistan, 464,000 lives can be saved up to 2060. Now bear in mind, during COVID, there were 1.8 million deaths worldwide due to the pandemic. So if in a smaller country such as Uzbekistan, almost 500,000 lives can be saved, this is not only relevant, this is urgent for public health at a global level and at a national level to embrace. So hopefully this report will add to the debate, stimulate more research, and make sure that lives can be saved in Uzbekistan, Malaysia, and elsewhere in the world by making sure that tobacco control is augmented by tobacco harm reduction products and methods. Thank you.
We would like to leave many thanks to the authors and the speakers today and congratulate them on such a interesting and important report. And you can find the report on thr.net and on our YouTube channel as well. You can find this recording there. So thank you very much, everybody, for tuning in, and we will see you again soon.